Hi, I'm Dr. Mark Jackson from Carolina Vein Care. We get a lot of questions about varicose veins because that's mainly what we do. Some of the questions we commonly get, for starters, are what are varicose veins? Varicose veins are dilated veins. They're normally very small, but when they begin to dilate, they become quite large, usually a bluish discoloration. They might even look like little lumps or bumps under the skin. And the reason this occurs is that normally the veins function to bring the blood back up the leg against gravity and back to the heart. And the reason why that works efficiently is that normally inside the vein, there are little one-way valves that only allow the blood to go up against gravity back to the heart. In someone with varicose veins, what has happened is that those valves have worn out. It's usually a genetic tendency. There's no diet or activity or position that brings this on. Is basically, if you're going to get them, you're going to get them. And when the valves wear out, gravity being what it is, the blood pools, or refluxes is the term we use, backwards to some degree, and that puts a lot of pressure on the veins, a lot more than what they're designed to tolerate. And as a result of that, the veins dilate and stretch, and that increased pressure gets transmitted into the skin and soft tissue in the area, resulting in the pain and swelling and other symptoms that accompany varicose veins. So that's usually how people present. They see the veins, and then over time, as they get worse, they notice aching, heaviness, itching is a very common symptom, and just pain. And while these symptoms typically aren't dangerous and don't threaten the circulation, they do impair quality of life. I mean, what can we do on a day-to-day basis without our two legs? And when they hurt and when they swell, medically it becomes more of an issue rather than just a cosmetic appearance issue. Speaking of that though, a lot of patients have fairly normal feeling legs, maybe a little achiness or a little heaviness, but we live in South Carolina. We're in the South, patients are wearing shorts, dresses, what have you, and their legs are exposed. And when that's the case, and they've got these visible veins, then oftentimes, just from a cosmetic and appearance standpoint, they want them gone. They don't want to see them anymore. They're embarrassed by the appearance when they're out and about, going to the gym and those sort of things. And that's certainly a legitimate reason to have them evaluated and possibly treated. Regarding treatment methods, there are a number and a large variety. Unlike back many, many years ago, when vein stripping surgery was the only option, that thankfully is, I won't say no longer done, but rarely done because it's not necessary with the newer techniques that we have today. Currently, the procedures that we do to treat varicose veins are all performed in the convenience of the office. They take maybe 15, 20, 30 minutes to do. You're back to work, back to full activities the next day. Very minimal downtime, very quick recovery, unlike the surgical techniques that were only available as an option many, many years ago. The results, again, are excellent. There are no incisions or recovering from general anesthesia or any large surgical scars or anything of that nature. Almost all of the procedures are done through little punctures using a catheter guided by ultrasound inside of the vein that's causing the problem. And when the catheter is activated, it generates heat, and that cauterizes or seals the vein internally to close it rather than having to surgically strip it or remove it. So that reflux is eliminated by closing the vein without actually having to remove the vein. And in so doing, that reflux is no longer present, the swelling goes away, the symptoms go away, and the varicose veins that are seen as little bumps under the skin typically regress as well. Now, sometimes there are still some remaining varicose veins after the ablation procedure has been performed, and if that's the case, they can be very conveniently and safely treated with injections, also done in the office, often under ultrasound guidance as well. The procedures are very safe, they're very established, they're performed by physicians, and results uniformly have been excellent. And in terms of prevention, that often is a question we get asked. It's often thought that by standing on cement floors or crossing the legs, that's what's caused the varicose veins. And just to put your mind at ease, that is not the cause. It's strictly a genetic tendency, and if you're going to get them, you're going to get them. But fortunately, we have very safe and effective ways to remove or eradicate the veins. Now, having said that, in some cases, someone who may just have a lot of swelling in the legs and other problems that can't as easily be treated with these techniques, then use of compression stockings does help reducing the amount of swelling and helping with the symptoms of pain and aching and discomfort in situations where the treatment options might not be best for that particular patient. So if you're someone who you believe you have varicose veins, you're suffering with them, you don't like the appearance, call us for an appointment. No referral from a physician is necessary. In fact, most people find us because they look at their legs, they see they've got varicose veins, they know mom had varicose veins, and there's no need to get any blood tests or x-rays or ultrasounds or even a referral to sort that out. Just call us and we'll be happy to evaluate you and provide any treatment that you might need.